Public anger directed to the healthcare industry following the murder of United Healthcare CEO Brian Thompson continues. Our next guest has a firsthand account of working as a healthcare executive. Joining us right now is Wendell Potter, former vice president at Cigna, who is now president of the Center for Health and Democracy, a healthcare advocacy organization. His recent piece for the New York Times is titled, "I Was a Health Insurance Executive. What I Saw Made Me Quit." Good morning to you, Wendell. Appreciate you joining us. What did you see, and why did you want to quit?
What I saw was what the insurance industry has done over several years to erect barriers that make it more and more difficult for people to get the care that they need. And it comes in many different forms. And that is what is fueling this anger, this outrage. Increasingly, patients are finding that even if their policy says something is covered, that doesn't mean they're necessarily going to get it because of the aggressive use of what's called prior authorization in health insurance by big health insurance companies, in particular by for-profit health insurance companies. Also by the excessive amounts of out-of-pocket costs that Americans are encountering. A family can be on the hook for nearly $19,000 out of their own pockets before their coverage kicks in. And this is while premiums continue to go up. The average cost of a premium for a family is over $25,000 now through an employer. So people are getting really fed up, and that's why I wrote that piece and why I have said that the reason for this anger is because people are finally waking up and realizing they have a voice here and have figured out how to express their anger.
Wendell, can I just stop you because you say people are waking up and have this anger? I will say, for at least for myself, I am so disturbed. Frank, I don't want to say I'm disturbed that we're doing this segment, but I'm disturbed that we're having this conversation on the back of and inspired by a murder. And it disturbs me because I genuinely fear that there are people that are angry and upset about all sorts of things in this world that they have every right to be upset and frustrated about, but that they are going to resort to violence as a way of trying to inspire and create more conversations like the one we're having now. Do you not have the same fear?
I do. And in fact, I've expressed that. I think it's just outrageous that we're seeing this. But on the other hand, like I said, it's somewhat understandable because people are really frustrated, and they haven't known in the past what to do with their frustration. Let's just say
it's not, Wendell, it's understandable that people are frustrated. I think we should just be very clear. It is not understandable that people are resorting to any kind of violence, threats, or anything else like it.
Wendell, you say it's reinvigorated a conversation that the industry has tried to suppress. So does that mean we should maybe go, if we're worried about police brutality, maybe we can reinvigorate that discussion by assassinating a law enforcement officer? Why doesn't it reinvigorate a conversation on mental health issues or on the decline in societal norms from something? I mean, I think this is as bad as what Elizabeth Warren said, that what you wrote in your op-ed piece, that almost like you just said it's almost to be expected, or now we're talking about it again because of this, because it was caused by the for-profit model. Do you want to get rid of all for-profit models across the board or just in healthcare?
I think you would say that in healthcare is what has not been working. It's only been since about the last 30 years that health insurance company has been predominantly through for-profit insurance companies. In the mid-1990s, that's when you saw many nonprofit blues convert to for-profit status. But let me back up. I agree with you. I think there should be a new discussion about mental health. One of the problems within for-profit health insurance companies is the difficulty that people have even accessing their benefits. The mental health provider networks are inadequate. Often there are a lot of people, doctors who are said that they are presumably in network, but they're not. It's called ghost networks. So there is a lot, I think, that this should rekindle a conversation about. I will say, though, I think it was absolutely outrageous and despicable that Brian Thompson was murdered. From everything I've heard about him, he was a good man and tried to effect change from within United Health Group. What I learned through my career is that that's really impossible. When you have these companies that are, their stock is traded on the New York Stock Exchange, that's a problem. And these companies, by the way, have not fared well on Wall Street this year. Cigna's stock is way down. That's where I worked. Humana, in particular, is way down. It's down about 44% since the first of the year. So these companies.
Is there a way we can fix? Is there a way we can fix the? Because the universal health care or single payer. Maybe in some countries with much smaller populations have had some success, but all I hear, maybe it's just tired, hackneyed tropes, but how long does it take to get a specialist in Canada? Or what's the national health in the UK? You hear about, when you increase demand where you want every single thing that, without any no one really minding the store for what you get, no one gets anything because the demand goes up so much, the supply stays the same, and then the entire system seems to suffer. And you get worse health care, it costs more, taxes go up. What's the answer? Is it possible to fix the system we have, or do we have to go to, as you want, universal health care and single payer?
No, I would challenge that. The Commonwealth Fund does an analysis of health systems around the world every couple of years. And of the developed countries, the U.S. always ranks at the bottom in terms of cost. We spend twice as much on average as the other developed countries do.
Drug abuse, lifestyle. There's a lot of reasons for that, right? And we consume a lot.
That's true, but the Canadians are just right north of us, and they spend a lot.
You can't get a specialist. It takes you 9 months to 9 months to go see for something serious. You probably die before you get it.
It does not in Canada. You might face a longer delay to get a hip replacement or a knee replacement in Canada, but not in. But you might, if you don't have health insurance in this country, you will wait indefinitely. It is not. That's a myth that I used to help create, by the way. That Canadians wait endlessly for their health care. It's not true. You don't wait for necessary care. In the U.S., increasingly, Americans are waiting forever for the care that they need, even with health insurance.